Thank you, Dr. Ken Waxman, for talking to us today about your experience in Sudan and with Future Doctors. What is Future Doctors?
Future Doctors for South Sudan is a nonprofit organization that I started with a small group of people, amazing people, who want to support South Sudanese students to get a medical education. As you personally know, there's almost no South Sudanese doctors. They've either left and they haven't educated new ones in a decade, and the country is just basically devoid of doctors. There's maybe a dozen doctors outside of the capital in the entire country of 10 million people.
And you were in South Sudan doing what?
I worked with Doctors Without Borders, MSF, for a 3-month stint, working in a small village, trying to develop a hospital that would have some trauma capacity in the north of South Sudan.
What sort of pathology were you treating?
Well,
you're a surgeon.
I'm a surgeon. I'm a general surgeon, trauma critical care, and I was all prepared to do big abdominal and chest surgery, and that's not what I did. It's old wounds and old burns and abdominal, the ones that are able to survive their ruptured appendicitis or torsion and then walk 2 days, come in with big abscesses. So just old, horrible pathology, neglected disease. And then I spent a lot of time taking care of tropical diseases, amazing pathology, leprosy and tuberculosis and, of course, malaria and anthrax. Just amazing things that you would never see here. It was a great experience, and I have a huge amount of respect for the expatriates who are providing really a majority of the healthcare in South Sudan. But when I came back from that experience, it became clear to me that it was a great experience for me, and I did help the people I helped, but it wasn't sustainable. And even though someone came after me, at some point that's not going to be there. It wasn't culturally very sensitive the way that we were practicing medicine.
But you met somebody there that you wanted to.
I did. My assistant was a local South Sudanese, very, very bright kid who had managed against all odds to finish high school and came back to his community and got a job with MSF and was assigned as my surgical assistant. So he and I were the operating team, basically. He was the nurse and the scrub tech and the sterilize the instruments. And so he learned a whole lot together and became very inspired and decided he wanted to go to medical school. And I said, oh, God, that's the best thing I could do is help someone become a doctor. And so we went kind of on this saga together to try to get him into medical school. There is no functioning medical school in South Sudan. It's started back up. It's still not functioning, but at that time it was not even existing. So we went to Kenya, where he had gone to high school, and thought we could get him at the medical school there, but they had kind of a rule not to take South Sudanese students at that point. So then he had to make his way to Uganda, where he didn't meet medical school requirements, and then had to do an additional year of preparatory school. But now he's a second-year medical student doing extremely well. Very, very proud of him.
And because of your efforts, you now have the nonprofit organization which is supporting several students, right?
Yeah, we have 12 students who either are in medical school, who are going to start this fall, or who we're supporting in their applications and are very qualified. So I hope that they get in. So we will hopefully, at the end of this year, have 12 kids in medical school.
In various places, but you hope eventually.
The real hope is to help the Juba Medical School get back on its feet and become an effective medical school. It's starting from a very bad place. Basically, the physical facilities and the teaching staff are just very, very difficult right now. So there's some amazing people on the ground here. I'm working with a young U.S. physician named Cholene Espinosa, who's in Juba now. And her efforts, she brought some of her medical school materials to try to one-on-one with the medical students. But in addition, she and her organization are funding a satellite link so that we can establish a telecommunication link to provide education. And I'm going to provide some basic science and some clinical lectures kind of as a beta test, and then hopefully organize a series of experts in many specialties to deliver some medical school lectures as well as some continuing education, maybe every day, maybe 3 times a week, so that there'll be basically a continuous opportunity for education. And that's a starting point. More importantly, we need to educate the educators there to get it going again.
Yeah, it's probably been a generation since there was a fully functioning medical school. And
yeah, so what happened in '95 when the truce was negotiated, North Sudan, which was the government that was supporting the medical school, pulled out all of the resources and left it basically vacant. The medical school's students were left without teachers and without resources, and it's never recovered from that. And the new government has had great intentions, but obviously the political chaos, there just hasn't been the resources. So there's almost no staff. It's voluntary physicians, mostly unpaid, and they don't come all the time. And the medical students are basically left to their own devices to try to get education and clinical experience. It hasn't happened, but it clearly is a future.
Yeah. Well, I have to say, it seems like an area that could have tremendous impact, just because of how little there is there to provide a medical education where there's no medical care. So your organization is someplace where anybody could donate and support students?
FutureDoctors.org, absolutely. We would be thrilled to have a donation, and also ideas, input, cooperation, participation. Any of that would be fantastic. We are hoping to work closer and closer with a much bigger organization called Real Medicine Foundation, and this is a well-established nonprofit who's all over the world, but much of their effort is in South Sudan, but they've been focusing on nursing and midwives. So there's, I think, a synergism in combining our efforts and having the medical education, work in hand with nursing and nurse midwives. So that's a fantastic organization, and I think would really help us have more of a footprint there.
Well, I wish you and your organization great success. Any last words about MSF or the organization? Well,
MSF is fantastic. Absolutely, they're doing essential work. I have nothing but good things to say about them. But in the long term for that country, they need their own doctors and nurses and medical facilities, and it's a very exciting threshold right now, because unlike many places in the world, there's nothing existing. It's a blank canvas, and I think the contributions that we all can make there have the potential to produce a medical system that actually works 10 years from now, which is very exciting, and that's where it's worth our energy, I think.
Absolutely. Thanks for talking to us, Dr. Ken Waxman.
Thank you, Chris. It was a pleasure meeting you.
Take care. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.